Hello, my name is Stella, and I was the Nuclear Medicine Registrar at the Royal Adelaide Hospital last year. I'd like to present the findings from our audit looking at whether the ventilation scan is important in ventilation perfusion scans with low-dose CT performed in patients with active COVID-19 infection and suspected pulmonary embolism. Our team have no conflicts of interest to declare, and the research committee at our institution has been informed of our retrospective audit. Venous thromboembolism and pulmonary embolism are known features of COVID-19 infection. VQ lung scans have been found to be useful in diagnosis as well as follow-up of PE. Initially, due to aerosol risk, ventilation scans were not recommended in COVID-19 patients. However, with increased COVID-19 vaccination rates, use of PPE, and implementation of additional safety measures, ventilation scans have been reintroduced. In September 2021, the Society of Nuclear Medicine and Molecular Imaging released an updated statement to recognize that in many situations, a ventilation scan may be necessary to help diagnose lung disease, including vascular and airways disease, and that performance of the ventilation scan could be considered based on local and institutional COVID-19 policies. Our retrospective audit was performed at the start of 2022 during the time of South Australia's first significant rise in daily case numbers since the beginning of the pandemic. The aim of our audit was to evaluate the benefits, risks, and diagnostic significance of performing the ventilation component of the VQ scan with a low-dose non-contrast CT in hospitalized patients with acute COVID-19 infection and suspected pulmonary embolism in order to determine whether performing the ventilation scan was worth the aerosol risk. The audit was undertaken at the main COVID-19 hospital in South Australia with capacity to treat up to 300 COVID-19 patients. Patients referred for a VQ scan over a 6-week period starting January 10th were studied. During this period, a total of 77 VQ scans were performed, all on a Siemens IntevoSpec CT camera with a low-dose non-contrast CT. Ventilation scans were performed using Technegas, and perfusion scans were performed using technetium-99 MMAA. In addition to full PPE, enhanced respiratory precautions were followed by all staff involved. The perfusion, ventilation, and low-dose CT scans of the COVID-19 positive patients were then assessed. In total, 77 VQ scans were performed over the 6-week period, with 14 patients, 18%, having PCR-confirmed active COVID-19 infection. The study population ranged in age from 26 to 90 years, with a median age of 62 years, with 7 females and 7 males. The indication for these scans included worsening hypoxia, breathlessness, pleuritic chest pain, elevated D-dimer, and pregnancy-related breathlessness. The reasons for not having performed a CTPA included renal impairment, pregnancy, young age, and allergy to iodinated contrast. With respect to the scan methodology, the patients vented to approximately 1,500 to 2,000 counts, equivalent to approximately 40 megabecquerels of Technegas administration. 200 megabecquerels of technetium-99 MMAA was administered for the perfusion studies. A low-dose non-contrast CT was performed with care dose on. 2 technologists were involved in all studies, both in and out of hours. One technologist was designated as the dirty technologist, who remained in the room with the patient at all times while in full PPE, which included an N95 mask, eye shield, full face shield, hairnet, gown, gloves, and shoe covers. The other technologist was designated as the clean technologist, who remained in the control room and performed all other related duties, including scan acquisition, data processing, and dose preparation. Communication between the technologists occurred using inbuilt camera speakers, doorbells for attention, and the use of pen and paper. Following scan completion, the Technegas masks and linens used for the COVID-positive patients were disposed of separately, and a full room clean was undertaken by maintenance staff. Of the 14 COVID-19 positive patients that underwent a VQ scan, 11 patients, that's 79%, had abnormal perfusion scans, but only 4 had VQ mismatches. 4 patients, or 29%, showed VQ mismatches that were positive for pulmonary embolism. Ventilation scans showed abnormalities in 9 patients, that's 64%, including in 2 patients positive for PE. 7 of the low-dose non-contrast CT scans were abnormal, showing COVID-19 changes and also pulmonary fibrosis in 1 case. The 1 patient who had a PE on the VQ scan but did not undergo a low-dose CT was a 31-year-old female who was 10 weeks pregnant and had a positive perfusion scan. A few selected cases will now be presented. The first case is of a 90-year-old male with severe COVID-19 symptoms and a history of pulmonary fibrosis. The VQ scan was negative for PE, however, there were extensive matched ventilation and perfusion defects. On the low-dose CT, there were changes in keeping with known pulmonary fibrosis. Most patients who suffer from pulmonary fibrosis do not experience VQ mismatches. However, in some, the scar tissue, collagen, and inflammatory cells in the lungs associated with interstitial lung diseases like pulmonary fibrosis can cause a perfusion ventilation abnormality. The next case is of a 62-year-old female who presented with marked hypoxia 8 days following the diagnosis of COVID-19. Both ventilation and perfusion scans were heterogeneous in appearance. As the defects were matched, PE was excluded. The low-dose CT demonstrated subpleural areas of consolidation and ground glass change, findings that can be seen in COVID-19 infection, and findings that could provide additional information for the referring clinicians. This 39-year-old female presented with hypoxia. Her past medical history included a PE during pregnancy years ago. As she had a contrast allergy, a VQ scan was performed, which demonstrated a large perfusion mismatch defect compatible with PE. The lungs were clear on the low-dose CT. Of our 14 COVID-19 positive patients who had a VQ scan, 4 patients, that's 29%, were diagnosed with a PE. 11 patients, that's 78%, had abnormal perfusion scans, but only 4 had VQ mismatches, confirming PE. Ventilation scans were abnormal in 9 patients, that's 64%, and assisted in accurate scan interpretation. The low-dose CT results provided information on underlying COVID-19 lung parenchymal disease in 7, that's 50% of patients. Our audit has found that VQ scans are a useful test in patients with active COVID-19 infection and suspected PE, and that the performance of the ventilation component of the scan and low-dose CT can provide valuable data, improve scan accuracy, aid clinical assessment, and can be undertaken safely with a 2-technologist per scan approach. All scans undertaken in the 6-week period were done so successfully without episodes of staph infection, confirmed on daily rapid antigen testing. Thank you.